Hey everyone, welcome back to Breathe Easy, the podcast where we discuss respiratory care, quality improvement, and the work happening behind the scenes to improve patient outcomes. I'm Danielle Hardy, your host here at the Medical Center, and today we're highlighting our Q3 Skin&Wound champion results and discussing a topic that's easy to overlook but incredibly important: skin integrity and pressure injury prevention. Joining me today is Brenda Andrews, Wound Team Associate and Respiratory Care Assistant Manager. Brenda, thank you for being here.
Thanks for having me, Danielle. I'm so excited to be about this incredible work our respiratory therapists and skin and wound champions have been doing to prevent device-related pressure injuries. So, Danielle?
Let's dive in. And because respiratory care isn't just about protecting the airway anymore, it's also about protecting the skin. Brenda, when people think about pressure injuries, they don't always think about respiratory equipment. Why is this such an important focus area?
That's exactly right. Many of the devices we use in respiratory every day can create pressure, friction, moisture that place patients at risk for skin breakdown. Things like nasal cannulas, optiflows, BiPAP masks, endotracheal tubes, securement devices, and tracheostomy tubes all have contact points that can affect skin integrity.
And many of these devices stay in place around the clock.
Exactly. When patients require prolonged respiratory support, even small areas of pressure can become significant injuries if they're not identified early. That's why routine assessments, repositioning, and prevention strategies are so important.
Every patient encounter becomes an opportunity to prevent pressure skin injury before it happens. Okay, Brenda, let's talk results. One of the highlights from Q3 was that 87% of the patients had no device-related skin breakdown.
And that's a tremendous accomplishment and reflects a lot of hard work happening at the bedside. Therapists are becoming more aware of risk factors, inspecting device contact points, and intervening earlier.
There will still be some patients who developed signs of skin compromise, though, but those findings help us identify those areas where we can keep improving.
Exactly. These audits aren't about perfection. They're about learning, tracking trends, and finding opportunities to strengthen prevention efforts.
Another encouraging finding was that preventative measures were actively in place during 87% of the patient encounters.
That tells us staff are making prevention part of their routine care. They're performing skin assessments, repositioning device when appropriate, applying pressure relief measures, and identifying concerns before they are worsened.
So it reinforces the idea that prevention isn't one of the big interventions. It's the accumulation of small actions performed consistently at the bedside.
Exactly. Those everyday practices can make the biggest difference for our patients.
As with any quality initiative, we also identified areas of improvement.
We did. While many interventions were appropriate, approximately 32% of encounters show opportunity to improve documentation and escalation of processes.
So documentation sometimes gets viewed as administrative work, but it's actually a critical patient safety tool.
Exactly. Good documentation helps track progression, supports communication between disciplines, and ensures wounds receive the attention and resources they need.
And when these concerns are identified early, timely wound consults can make a difference. One finding that caught my attention was the education documentation.
Yes, only 49% of encounters include documented education for patients or staff.
That's an important opportunity for growth.
It really is. Education helps everyone understand early warning signs, prevention strategies, wound referral process, and best practices for skin assessment.
Sometimes education occurs, but it isn't always documented.
Exactly. We need to provide both. Provide it, capture it, so we can measure its impact.
One of the most exciting developments this quarter has been the partnership between our respiratory skin and wound champions and the wound, ostomy, continence nursing team.
Yes, this collaboration creates a stronger support network for patients and staff. Respiratory therapists bring expertise in respiratory devices, while wound care specialists bring expertise in skin integrity and wound management.
Together, we're creating a more comprehensive prevention strategy.
And we're building shared accountability. Preventing pressure injury isn't one department's responsibilities, it's everyone's responsibilities.
Let's talk equipment. There have been some exciting developments underway in equipment and supplies.
Yes, we've started evaluating products specifically designed to reduce evidence-related pressure injuries. One example is the OptiFlow ear protectors, which help offload pressure from high-flow oxygen devices like venturi mask, oxygen mask. Another is the Hollister Slim Fit, Ankle Fast accessory system currently on evaluation.
These products will offer another layer of prevention beyond what we're already doing clinically.
Yes, exactly. The goal is to reduce injury risk at a source whenever possible.
And Brenda, I have to take a moment to recognize your leadership in helping moving these initiatives forward.
I appreciate that, Danielle. Thank you. It's truly a team effort, and I'm proud of the collaboration we've seen across respiratory therapy, wound care, supply chain, and leadership.
As we wrap up, let's summarize our biggest Q3 takeaways.
Okay, first, 87% of patients had no device-related skin breakdown.
Second, preventative measures were present in 87% of encounters.
Thirdly, wound intervention documentation continues to improve, but there is still room to strengthen consistency.
And finally, education remains one of our greatest opportunities moving into next quarter.
Most importantly, we've established a strong interdisciplinary partnership and are continuing to explore equipment innovations that can improve patient outcomes.
Brenda, thank you again for joining us today and for all the work you're doing to advance skin integrity initiatives throughout respiratory care.
And Danielle, thank you for having me. It's exciting to see how much progress we've made, and I'm looking forward to what comes next.
And thank you to everyone listening. Remember, skin integrity is truly a team sport.
And protect the airway.
Protect the skin and protect the patient. Thanks for listening to Breathe Easy. We'll see you next time.